Hi everyone, and welcome back to another episode of Ask Adam. I'm Stephen, and as always, I'll be putting your questions to Adam this month. It's been a busy few weeks since our last update. A lot has been happening across the board, especially with the work around Stage 4 escalation, and of course the appointment of Laura Skaife Knight, who will be joining us as new Chief Executive in September. Adam, before we get into the questions, is there anything you'd want to share about how all of that's progressing? I know there have been a few drop-in updates and engagement sessions planned, so I thought it might be worth you letting folks know what's coming up.
Yeah, thanks, and hi everyone from me as well. So yeah, a couple of things you mentioned there. So yeah, really pleased that the NHS Grampian board's appointed Laura Skaife Knight, who's currently the Chief Exec in NHS Orkney, someone I've worked with in the north of Scotland, and she'll be a really fabulous asset for NHS Grampian. And just as you know, I'm meeting Laura on a weekly basis already, just to start that handover process, so that she absolutely hits the ground running when she arrives in the next couple of months. I just wanted to spend a moment, if that's okay, Stephen, on the broader stage 4, level 4 escalation. So we've had, hopefully you feel up to date with the Thursday weekly slot in the Daily Brief about the escalation. Key things to mention are we're now developing the improvement plan for NHS Grampian, and really importantly, the improvement plans about improving our performance around unscheduled care and planned care, and also making sure we're paying attention to the financial position. So it's really those three things initially over the next few months to really try and make a good bit of progress in those three areas. And related to that, this week we're doing some additional preparatory work. We're trying to understand that external diagnostic work from KPMG, which has been really helpful, alongside the work we've got in unscheduled planning and planned care planning, and trying to think what the improvement plan looks like. I'm meeting with the non-executive board members to get them absolutely up to speed with our next steps, as well as the advisory structure. So we're meeting yours and my co-chaired the area partnership forum, Stephen. We're also meeting the area clinical forum, and I'm also meeting a number of management teams to get them absolutely up to speed with what we're doing. I'm going to do a series of drop-in sessions that absolutely anybody's welcome to come to, and it would be great to see lots of you at those. Really important is a bit about what we're doing, and I've absolutely got an ask in those sessions about what I need everyone to do to be part of this improvement that we'll do together as NHS Grampian to get us to that sustainable future. So that was all I wanted to mention. I hope that was okay, Stephen. Just a bit of telling folks where we're up to and the key role that they're going to have as we go forward.
Yeah, no, thanks, Adam. That's great. And I guess unsurprisingly, one of the colleagues' questions that we've had come in is actually linked to the external diagnostic review that KPMG have been doing. So an anonymous colleague who is a nurse manager in Aberdeen has written in the Daily Brief, we were informed that KPMG, the external organisation appointed to provide additional support to the board following our escalation to level 4, they would meet with NHS Grampian weekly and would identify opportunities for efficiency and productivity improvements. Could you please confirm who will be paying for this large company to carry out this piece of work? And if NHS Grampian are paying, can you inform us of any further financial pressures this may cause?
Yeah, thanks. A really important question. Just to be really clear how this is working. So as part of our escalation to stage 4, the Scottish Government have paid for this diagnostic to be done. So that funding has come directly from Scottish Government to pay for KPMG's work. We've now received the report and explored the report at the assurance board. So that's the with the Scottish Government group who are overseeing our escalation, and that's going to be the basis of the conversations that I was referring to earlier on. A bit of that and a bit about the work we're already doing, but it's being paid for directly by Scottish Government.
Okay, thank you. Next question we've got is from Irene Thompson, a healthcare support worker who works in the Aberdeen Fertility Centre. And Irene writes, can you explain why it is no longer possible to provide refreshments for day ward patients within our outpatient clinical setting? These patients are required to fast before their procedure and therefore need to eat and drink before they're discharged.
Yeah, so I know why this has happened relating to our internal cross-charging, but I'm not content with that. So on the back of your question, Irene, and thank you very much for this, I've asked Alec Stephen, who's our Director of Finance, to meet up with June Brown as the Executive Nurse Director, just to try and understand what we do need in place. So my sense is, we either need to feed people or we don't, and if we do, then we need to figure out a way to do it, despite the absolute right and best intention of stopping the cross-charging and things, which again is all really clear in our financial context. So Irene, the plan is that June and Alex will make some progress on that, and I'm sure it won't be unique to this setting, so that we get the best of both the financial challenge we've got, but clearly at the centre of what we do, we have the patients and their requirements, and we'll update at the next one. So thank you for the question.
Okay, thank you. The next one comes from Joanne Gallagher, who's a Child Smile coordinator. Joanne says, is anything being done to ensure our procurement contracts are best value? There's long been a feeling that there's an NHS premium applied, and this was highlighted recently within my department when ordering from a contracted supplier, and they sent us goods that they had purchased from Amazon, complete with receipt, and applied a 33% premium.
Right. Yeah, just sounds horrific, doesn't it? So, and I'm absolutely certain our procurement colleagues will want to know about that. So, through Mike McKenzie, who helps us and supports us with these Ask Adam sessions, Mike's in touch with procurement to make sure they're aware of this and to try and follow up. I think on the slightly bigger picture, and I think we've probably all experienced this sort of thing where it seems very expensive, that Joanne's pointed out. On the whole, as a big procurement system, we know that the really tight controls that the procurement team have and the huge expertise they have, we do collectively across the NHS absolutely drive prices down. So we do get really good value, and that's one of the things that they're assessed on an annual basis, around how we achieve best value. I think there'll always be areas we can keep working on, and how do we do the competitive tendering really successfully. And again, that's one of the things that the team do an annual assessment on. And I get it. It often feels like we pay over the odds for some things, and you definitely experience that in various bits of the work we do across it. So really key point, my kind of key messages are, we do need to keep using procurement because it adds, on the whole, across the big system, good value, and it genuinely does really good value. It also absolutely supports all of our financial controls, so living within our standing financial instructions, so the governance that's really crucial around it. And interesting, the KPMG external diagnostic did have a little section on procurement, and there are a number of things for them to look at. Again, really relatively very small. I happened to meet Jennifer Yeomans the other day, who's the head of procurement, and Jennifer was clear there was those things that they could look at to see how we continue to squeeze best value out of the procurement process. But this particular example, Mike's picking up with Jennifer and the team to see how we do that as well as we possibly can all of the time. So thanks for the question. I understand the shared frustration, and together, as we keep working together, we can keep absolutely making that as robust as possible. So thank you.
Okay, thanks, Adam. So we've had a couple of questions about the UK Supreme Court decision on gender identity that came in recently. Dawn Marr, a community mental health nurse, asks, what plans does NHS Grampian have to address the implications of the decision for staff and patients? And another colleague, Amy Morgan, asks specifically, what plans do we have organisationally for maintaining the safety and dignity of patients during admission to hospital in multi-bedded wards?
Yeah, thanks to both Dawn and Amy for the questions. So undoubtedly, this is quite a challenging topic for us as an organisation, for lots and lots of us all working together in the organisation, and clearly has implications for what we need to do and how we're going to organise ourselves going forward. I guess the overarching thing that's most important at the moment is, we absolutely strive to treat everyone that's in our care, whether that's patients or staff or absolutely anyone that comes into contact with us, with dignity and with respect. So that's the overarching, really crucial thing for us. At the moment, we're awaiting national guidance. So one thing I'm really clear on, we're not going to start making up our own guidance as NHS Grampian at all. We are going to be part of the Once for Scotland approach and follow the national guidance. We understand that's coming to us very soon. Again, Stephen, you're very well connected with lots of the policy and guidance bits, so you might know more than me about when it's coming. But as an organisation, we're going to wait for that guidance and then follow it. And of course, as we get the guidance, we will share that widely and explain how we'll approach, this UK Supreme Court decision. But thanks for the questions. Sorry, that sounds like I don't really know. It's not I don't know. We're just clear we're going to follow that national guidance.
Okay. Thank you, Adam. Next question is from an anonymous colleague who is a domestic assistant in Aberdeen. And they would like to ask whether Adam knows what the rationale behind discontinuing internal recommendations for domestic staff who are seeking to transition to bank healthcare support worker roles is. The colleague feels this could hinder career growth and impact staff morale, and asks what are the future plans regarding this approach.
Yeah, I think a really simple and straightforward answer here. I think we had a bit of a system where people went on the bank and moved into the start of these clinical roles through the bank route. And the most important thing is that if anyone that's working as a domestic wants to think about moving into a clinical role, a healthcare support worker, or starting another journey into a clinical role, we just need to do that formally through the training and education route. And so, lots of opportunity to do that within our organisation, always seeking to expand that cohort of people that have clinical roles. So it was just to do with that rationale of making sure we're doing it through a properly identified training and development route. So the person that asked the question, I think, was anonymous, weren't they, Stephen? Yeah. If you're interested, please absolutely work with your line manager, with other people in the training and development team to understand how you get onto the formal course, and I hope that works really, really well for you.
Okay, thank you. And finally, we've got an anonymous occupational therapist in Aberdeen who has emailed and comments, given the extreme financial challenges, does Adam think it is still appropriate to offer such a large relocation package to all potential employees of up to £8,000? Is this necessary for staff relocating within Scotland and for all posts? Some expenses allowed appear very generous. How many posts are really that difficult to recruit to and require this to encourage applicants? Given the number of posts advertised every month, this could potentially be a significant amount of money.
Yeah, gosh, what a great question, actually. So I think we often have things that we just expect. So I really like the challenge, actually. Now that said, I think it probably is the right thing to do. So the end of the question was, how difficult is it to recruit to certain posts? So one of the drivers of our financial challenges is absolutely under recruitment and having to fulfill posts with temporary staff who are more expensive than permanent staff. And so, you know, in the grander scheme of what we pay for, you know, premium rate coverage of things, I suspect the £8,000 probably disappears reasonably quickly for lots of roles, not for all roles, but for lots of roles. And I think it's one of the things that we need to keep balancing, isn't it? That how do you so, you know, would the relocation attract someone to come here and move? Absolutely not. We need to be an attractive organization to get people to come. And I think once they're coming, we then need to ensure people aren't out of pocket for that bit of the movement in their career progress and things. So a good one. And I think if we didn't have it, then we'd definitely be not competitive with other organizations, because people will continue to offer that. Great question. I'll pass it on to Philip and Alex. That's my sense of we need it, but I'll get Alex and Philip to give it some thought as well. And I'm pretty sure we'll need it to stay competitive and to support people to come and work here in what I hope you all agree is a really fantastic organisation to work in. But thanks for the question.
Okay, thank you, Adam. That's us for colleagues' questions this month. Thanks to everyone who sent in a question, and to Adam, of course, for the answers. If we didn't get to your query this time, don't worry, we are keeping track, and we'll come back to more questions in future sessions. As always, keep an eye on the Daily Brief and the internet for updates, and if you've got something you do want to ask Adam next time, just drop it in through the usual channels.